Right, today's topic it's about danger signs that you see when you see them in your periods. During your periods, you have to consult your doctor. These are the things when you see them during your periods, you don't have to ignore them, please. You have to get concerned. And the first point is having a cycle less than 21 days. If your cycle is less than 21 days, my friend, my sister, you need to go and consult, because we need to see, is it a hormonal issue? Is it stress issue which is bringing that? Is it issues with perimenopause symptoms or signs? So you have, is it STDs like chlamydia? So you have to go and do a checkup. And people who have issues with cycle less than 21 days, they get problems getting pregnant because it is not easy for them to trace the ovulation days. So you have to get concerned. Another point you have to get concerned with is having a cycle greater than 35 days. Having a cycle greater than 35 days, you have to get concerned because it is not easy for you to get pregnant because you cannot trace your ovulation days as well. You can be having polycystic ovarian syndromes like PCOS, so you have to get concerned. And you know, people have greater than 35 days cycle, they have issues with female hormones, they have more of androgen hormones. So please, you have to get concerned. You go to your doctor and inquire. If you have a period that lasts for more than 7 days, it is also issue. It may be a sign that you have uterine fibroids. It may be a sign that you have infections. It may be a sign that you have endometriosis. So you have to go and consult. If you also have extremely painful periods, you've gone to the pharmacy, you have used some painkillers which are strong, but they have not worked, it may be a sign that you have endometriosis. Endometriosis also presents with painful periods. You can have pain in defecating, issues like that. You have to go and they do a scan. They can order from some investigations. They do biopsy to find out whether you have endometriosis or it is a cancer. Then you can also, those people who have also 2 days periods that last for only 2 days, it is a concern. It may be a sign of hormonal imbalances. You may be having less estrogen, less progesterone, less. So you have to get concerned with that. And then it may be also a sign of stress. You may be having stress, you may be having infections, UTIs, STIs that you didn't treat very well, even having even having what you call bleeding in between the periods. If you bleed in between the periods, it may be a sign of issues. It may be a sign that you have hormone imbalance because of you've used birth control pills, infections, especially infections around the cervix. You may be having sexually transmitted diseases, chlamydia infections. You may be having thyroid hormones disorders. So you have to consult. Even when also you miss your periods. Missing your periods is also a point. You have to go and consult your doctor. It may be a sign that you are pregnant. It may be a sign that you have stress, a lot of stress. It may be a sign that you have polycystic ovarian syndromes. You may be saying you have primary ovarian insufficient. Primary ovarian insufficient, it means that your ovaries are not functioning. They are not doing their real work. So you have to go and they inquire. You have to go and they do a test. Primary ovarian insufficient, I will talk about it more in detail in the other lectures. But what you have to know here is that if you have primary ovarian insufficient and you are less than 40 years, if your ovaries are not functioning and you are less than 40 years, it is a concern. Please, you go and consult from your doctor. I talked about around 7 points. The first point was having periods less than 21 days. Another point was having periods greater than having the cycle greater than 35 days. I talked about periods lasting for more than 7 days. I talked about periods that last for only 2 days. I talked about extremely painful periods, missed periods, and bleeding within periods. Please, you have to consult from your doctor. If you've liked this video, share it with your friend. She can get concerned, she can share with another person. And you can also follow me on YouTube using Dr. Pills on YouTube. I use Dr. Pills 30. Please, you can also WhatsApp 0708 30 24 82. Thank you.